everyone, and welcome to Conversations podcast. Before we start, please don't forget to subscribe and turn on notifications. Today, I'm with Associate Professor Holly Seale, who is an infectious disease social scientist at the School of Population Health at the University of New South Wales. She is one of the developers of the COVID-19 Glossary, which was launched by New South Wales Health in July 2021. Welcome, Holly, and thank you very much for joining me today.
Thank you, and hi, everybody. It's lovely to be here.
Congratulations on the launch of the COVID-19 Glossary. Tell us, what is the COVID-19 Glossary and why did you find the need to develop it, and what does it aim to do?
Yeah, look, we have been doing research focused on vaccine acceptance and uptake amongst migrants and refugees for many, many years, working with colleagues at the University of New South Wales and with other universities around Australia, that we knew that even before COVID, that there had been disparities, so differences in vaccine coverage amongst people who are Australian born and those who are born overseas. And so we had concerns that that would also be the issue when it came to the rollout and delivery of the COVID vaccines themselves. And so after undertaking a large number of interviews with different stakeholders around Australia, including people working in government and non-government organisations around multicultural health, refugee health, and others in the sector, we identified that there was a gap in the kind of confidence and understanding of people in the sector around, the kind of terminology or better word, jargon around these vaccines. And that's totally understandable. I think for all of us, we've really had to shift, our understanding and also certainly, our language when it came to the introduction of these COVID vaccines. They've got new terms, new phrases, new words that we just haven't used before when it came to immunisation. And so what we wanted to do was to support those speaking COVID or having to talk about these COVID vaccines. And so that is really where the glossary comes in. It includes all of the terminology, the kind of jargon around the vaccines in terms of development, in terms of their use in the community, around the different safety aspects that have been coming out. And the glossary really aims to kind of break down that medical terminology in a way that would then help someone integrate the term or the different phrase into everyday language.
I mean, you're right in saying that culturally and linguistically diverse people might not have access to this information in their language, let's say. But literacy and health literacy, they're different things, aren't they? Even speakers of English, with their mother tongue, they find it very hard to understand all this language around COVID-19 and mRNA and what's a spike protein. It's not stuff that we hear every day. Or we didn't anyway.
I have an undergraduate degree in biomedical science, and I still can't remember all of these different terms because we don't use them. We forget about them. They either go out of our everyday language, and that's, to be fair, we other things, we need to focus on other things, or they may be very new terms for people. And so, this glossary is for anyone who is trying to communicate in their own community. And so it is, we appreciate that, across all sectors, that health literacy is an ongoing issue, and that about 60% of our communities have lower levels of health literacy. And so that's the capacity to process information about health issues or about medical data or about accessing a medical care. And so what we want to do is try and come up with a way that within our oral communication or in the documents or communication pieces that we're producing, that we really, use words that are much more familiar, help us to understand each of these different terms.
And how many languages is the glossary available in?
Yeah, at the moment we've got it in simplified English, and then we've got it in another 29 different languages, which I'm so proud to see. And was really, the work of, a range of different people, including Lisa Woodland at New South Wales Multicultural Communication Unit. It was also supported by Refugee Health up in New South Wales and others. But I'm hoping that this isn't it, that we will get further support to expand the number of languages that the glossary is available, because it's one thing to have it in simplified English, but we understand that it is much more useful to the sector if it is available in their own language. And as part of that process, the different teams involved with this have called on the support and time of a range of different people to make sure that when it did come to translating the simplified terms, that we still got the right feel for them, and that they were medically correct, but that they also use words that are relevant to the community.
Did you get feedback from the translators? Did they find the simplified version easier to translate?
Oh, they were tough on me. They were very tough. They kept coming back and saying, "Holly, this this phrasing isn't working," or "How do
Mm.
we build this into our conversation? It just doesn't feel authentic." And certainly, I was hearing it from both sides. So, because these are immunization terms and they are medical terms, it's really important that they are correct, because we've got enough misinformation already out there in the community. We don't want to be contributing to that. And we really want to build people's understanding of these vaccines, because that helps people trust and feel confident in what they're receiving. And so, working with, people who are, working every day as translators and interpreters, people who are working within multicultural communication units, and also those who are working at either the kind of development stage of vaccines, or who are involved with the development of policy around vaccines.
Mm.
We got a lot of different input into them, into the development.
That's great. I mean, this is a great tool, but it's one of the many tools with the education of the communities, isn't it, of the public? So we can't put all the responsibility on this one glossary. It's not just about terms and definitions. People need to be educated on all these matters, and not just COVID-19 and vaccination, but many other health issues as well. But yes, it does play quite an important role, but it is not the only tool when it comes to education.
No, that's certainly it. And we, like, I would personally like to acknowledge all the fabulous and great initiatives that have been used already out there in the sector. The opportunity I've had to speak to different stakeholders who support their communities in different ways, and to hear about the phone calls they've been doing, about the Zoom sessions they've been running, about going into their community and dropping off food parcels to
Mm.
those in need. I've been humbled to hear about all of those, and I think the as I've been trying to do is shout that from the rooftops when people say, "Oh, but what's being done in community?" There is heaps being done in community, and what we need to do now is just to continue to support those efforts. Talking about immunization is not an easy thing. People in primary care, so doctors and nurses in primary care and in other health settings, they receive a lot of training to talk about immunization, but they also do it day in, day out.
Mm.
And so they've worked out the kind of strategies that help, or the approaches that support people to accept a vaccine. But what we're doing at the moment is calling on a much wider number of people out there in the community to also be vaccine ambassadors. And that's great, because When it comes to adults receiving vaccines, we know that they may not necessarily always get a vaccine via a GP. They may get vaccinated in their workplaces. They may get vaccinated in pharmacy settings or elsewhere in the community. And so these people may not necessarily have a habit of going to a doctor to ask questions about immunization. There may be others also who are reluctant to go near a doctor's surgery because of that fear of being exposed to COVID. And so, how do we get, information out to these community members? What opportunities do we give them to ask questions or to raise any concerns? And this is where the government, the Australian government, and others have really been highlighting that community leaders, faith-based leaders, but also a wider network of people, including settlement workers, case workers, multilingual health workers. They play such a role at the moment with being that connecting point into community. And so, taking on that role, in such a positive way is fabulous. And we've been asking so much of these community leaders so far during this pandemic to promote, their understanding around, hygiene, around mask use, around the lockdowns. Again and again, we ask them to be that piece of the puzzle, in making sure communication gets through. But we've asked them again to talk about the vaccination. And so what we're trying to do, is give them the tools that they can use to help, firstly, support their own understanding about these vaccines, make sure that they feel confident in what they're saying, and then also then give them the tools to then go out into community to deliver messages or to answer questions in a way that will have impact. And so we're up here in New South Wales running training sessions at the moment with a range of different community advocates and leaders and other stakeholders to help with that confidence building. And those training sessions have also been run in Victoria and elsewhere around Australia. And so what we need to make sure and call on the government really is to make sure that anyone who wants to receive this sort of training has the opportunity to, because if you if we're calling on these stakeholders to be advocates, then let's resource them and provide them the tools to go and do that.
I think everyone's working really hard. All the communities, community leaders, researchers like yourself, GPs, everyone who can is helping out at the moment. And especially these days, I think we're all playing a little bit catch up as well. And the government's doing, both state and federal governments are doing the best they can too, I believe. So, hopefully there is a little bit more traction. Everything moves a little faster, and people actually have access to the information that they need to get so that they can make up their minds in the right way. Well, in your research, did you have a look? We all know that there's vaccine hesitancy among the Australian population at the moment. It could be for whatever reason, lack of information, some certain maybe eccentric beliefs that they might have, if I may say that. Would you say that hesitancy is higher within the culturally and linguistically diverse communities? Did your research give any indications of that?
So it's important to note here that when it comes to COVID vaccine acceptance, that we think around 70% of the community, and this is all of the community in Australia, are really willing to go up and get the vaccine, and that's fabulous. This is the group that are already made up their minds, perhaps have already received 2 doses, maybe have received 1 dose,
and waiting for that vaccine now.
They're on that journey, and that's really lovely because they themselves also will become advocates. Following behind them, there's this group of about 15% of the population who are, I like to call, fence sitters. So the people that may not yet have decided which way to go, and this term hesitancy keeps being used, and And that's, and that's an official term, but it's, is it helping right now? So I'm just
Mm,
wanting to call them the fence sitters. We are wanting to work with that group, to bring them along. And for many of them, it is about safety. So having those questions or concerns about the safety of the vaccines. And so as part of the training and as part of conversations we've been having with community is to make sure people understand that we are tracking the safety of the vaccines, and there's great websites available that you can see real-time data on about the localized, or more kind of effects of the body that you get straight after the vaccine. And I had
mm,
my one of my doses this weekend, and certainly, felt I felt achy, I felt
mm.
tired.
Same.
I needed to have a bit of a lie down, but with two kids and everything else happening, I didn't get that. Didn't get that. So I pushed on, which was probably not what I should have done. But that's it. I'm sharing my experiences because this is what happens. But we have that bit of myth out there at the moment that we have these kind of so-called long-term effects. And this has been building a bit of confusion in the community that because these vaccines have only been available for a short term, we don't know what could be the impact on people down the track or down later in the time.
Mm,
But what I'd like to reassure the community on is that, what we know historically about all of the vaccines that we've introduced over the years, for those for kids, those for adults, all the way back and probably even further back, to the 1960s when we first started using the oral polio vaccine,
mm,
is that if we're going to see some sort of event or effect of vaccination, but it comes quite quickly. It comes within the first couple of months. And, if we now think about that situation and the history of vaccination, we have had that exact issue with these vaccines. And so we had the issue of the clots show up quite quickly.
mm,
After that kind of 2-month period, none of the vaccines we've introduced over the history of vaccination have shown any sort of long term effects, because the way the vaccines work and the way they work in your body, you are more likely to have a more immediate effect. And so that's a really important myth that we need to break down. And so that is definitely causing some people to be uncertain about vaccination, and people, those who may be sitting back and thinking, well, do I really, feel that the vaccine is safe? Then those are the ones who need to go and have a chat with their doctor or a health professional about, to be able to work out what is the risk of COVID versus what is the potential for the effects of the vaccine. And there's some nice, again, tools available and information on the websites where you can see information visually, or there's tools where you can compare the pros and cons. So we call it a decision guide, to help you break down. But what I want to do in terms of bust a myth is this kind of sentiment that vaccine hesitancy or this uncertainty is greater amongst culturally and linguistically diverse communities.
mm,
Historically, again, from all of the research that we have done over the years, talking to migrants to Australia, talking to refugee groups, you know, all of the sentiments that come from those populations is that they are strong believers in the need for vaccination, that they are advocates of vaccination. And often they can come and be actually overly immunized when they first arrive to Australia as compared to other Australians because of that process of migration.
mhm,
And what the challenge is often, and where we see then gaps emerge between migrants and non migrants to Australia in vaccine uptake, is usually because of other elements. And that may be because of the challenges with accessing healthcare because of language, the issues of accessing immunization services because of the costs, and time, and other elements, and not necessarily because they don't believe in the vaccine.
That's right.
And
Now, when you say that word hesitancy, it's not like these people are really hesitant. We maybe have to look at that as a noun and not as a verb. Like you said, they might not even know anything about it, so we can't just say, "Oh, these people are hesitant." You know.
Yep, we need to really keep working with community to understand what is happening in community, and certainly everything I'm hearing from the community leaders that I'm speaking to talks to ongoing issues with accessing the vaccines, um, but also about just navigating the booking system, and
Mm,
so actually being able to work through the system. It is now available in other languages, which is great. However, that vaccine eligibility checker, there are still gaps in the process. And so, depending on the software you use to book your appointment, you may still end up having to cross the system and use another system that's only available in English. Or you get to the long, convoluted consenting
mm.
process, which, is a lot of information in English. Or, if you try and navigate through the mass vaccine booking systems, there's a lot of points on the journey of
It wasn't
trying.
easy to book mine. I will tell you that.
I've heard that so many times, and even myself, I know I went through a mass vaccine clinic, and it kept saying to me, "Oh, your appointment hasn't been booked." And I thought that's very strange because you've just sent me an email saying my appointment's been booked.
That's
So
right.
the system wasn't talking to each other, on that day. So I just, we know that there is certainly flaws, and to try you know um, help community to navigate these systems. I've been hearing about some great initiatives being used, and one I'd like to draw attention to is something happening down in South Australia, where the health department set up um, pop-up booths at local shopping centres, so that people would, it's not about receiving the vaccine, but just about helping them to navigate the booking system.
Mm.
So
That's
they're
a
like,
great idea.
yeah, like hotel concierges. They're there to, to just walk you through that booking system. And if that was available, in areas where people are not as mobile, people are, having trouble with getting through the technology side of things too, that may help. I certainly applaud the efforts up here in New South Wales about getting pop-up clinics available in um, community centres, in faith-based centres. That is fabulous, and the lovely stories that we're hearing from those centres, really are worth repeating. And one story I saw the other day on Facebook was about a young couple who walked into one of the pop-up clinics for their AstraZeneca doses, um, in I'm not sure what suburb it was in, but in one of the areas where there is increased transmission at the moment in Sydney. And
Mhm.
this young couple went and got their vaccines on their wedding anniversary. So most other people would think about, maybe a nice dinner at home. And this couple instead thought, let's go and get vaccinated. And what was important here is that their reason for getting vaccinated wasn't necessarily because they identified themselves at an increased risk, but instead they said that they wanted to have more wedding anniversaries down the track. And that was it. That was their reason, and the factor that motivated them to go and get vaccinated. And I love stories like that. I think I would love to see them at the 11 o'clock press conferences, standing there telling everybody their story. But I've heard others who have said, you know, we should be promoting the need to get vaccinated because, there are small businesses out there that are really failing to keep
Yeah.
open. And how do we get these small business owners to be front and center of this campaign and say, I'm getting vaccinated because I need my business to reopen? And so many stories out there and so many reasons why people are motivated to go and get these vaccines. And we want to help all of those people to get to a clinic, and to get their story out. And so, I encourage people who do go and get vaccinated to share their experiences with their family and friends, because there is misinformation out there. There are certainly rumors out there circulating about the vaccines and about
Mm,
other issues during the pandemic. And the best way to counter some of this is to tell your own experiences, because you're more likely to trust what your family and friends did. And if they had a positive experience through the booking system and through the clinic, and afterwards, you're going to feel more comfortable to also go and do that.
and you're right. I mean, there's a lot of doom and gloom about the whole thing at the moment, and yes, it is definitely depressing with all these numbers and all the lockdowns and everything. But you're right. I think we're focusing a lot on the negative. We see case numbers, we see number of vaccinations, or we're just focusing on how much we need. There isn't enough vaccinations. There's lack of information, but there is also a lot of people getting vaccinated,
Yeah.
and for these people to come out and say how they did it, maybe show the way, and share their experiences and talk about why they got the vaccine, like you were saying, and you're right. People want to have more anniversaries. They want to be able to get married so they can have anniversaries. I was reading today in Victoria, just before an hour before the lockdown, this couple just rushed their wedding so they could get
Oh,
married just before the 8 p.m.
oh,
deadline. So it's not all doom and gloom. You're right. We should share our positive experiences, and I guess everyone's doing the best they can.
yeah.
I want to bring you back to a little bit before where you said, all these effects of the vaccines usually, in the since the 60s, we can see that it was happening in the first few months, if anything was happening. And I guess with our vaccine rollout program being a little slower than the rest of the world, it also gave us an opportunity to see any effects, whether it be in Australia or around the world. And maybe that's one positive we can take out of that when we're making our decisions.
Mm. That is certainly people respond to different respond in different ways. And for some people, seeing data is really important, because I can say to you a vaccine is safe, but people will think that I have an agenda to promote vaccination. But I'm also mindful that if I said my statement with some statistics behind it, that will also help with some people, but not everybody. And
Mm.
so it is about having a range of different approaches to working with and communicating to the community, and making sure in the end that all of the resources are accessible, that they are, within our reach, that they are on websites where you don't have to scroll through pages and pages of,
I mean,
documents to
so
get
many
to.
so many websites have translated material on there. Okay, so and this translated material is for people who need the information in their language, because they might not speak English, or their English might not be as strong. But even just to navigate through those websites, to find those translated material, I don't know how many things you have to click to get to the actual document. And then you're lucky if the document is a new document, if the link isn't broken. I mean, how are we going to solve this issue? With all due respect to everyone out there, especially within governments and policymakers, it's great that you're doing this, but for me, it just sounds like you're ticking a box. But you have, are people actually accessing this information? We have
That's
no
a good
idea.
question.
you know Most people, in my experience, are getting their information from um, uh, their country of origin.
Yeah.
You know, they might be watching a cable TV, internet TV, and they watch a lot of news and information sessions, not necessarily that's made in this country for the population of this country, but from their country of origin. And you know, I think that's in a way our fault for not being able to have that information accessible to them. And
Oh,
each
goodness.
country's information relates to that country. Yes, there is general information about COVID-19 and vaccines, but I'm pretty sure there are things that are particularly important and special for this country. Thus, information has to be made here to be given to these people, right?
If I heard that one time, I've heard it over 70 times. With every interview that I did with community stakeholders and community leaders, they all said to me, Holly, you know, nobody listens to the local news. You know, even some of the SBS translated news channels, you know, why listen to that when I can just stream it from my country of origin and get it up to date? And get it presented by someone who I'm familiar with and comfortable with. And so, you know, I think that is certainly something that we have perhaps not sufficiently addressed, that we could be priming the community more, that, you know, they are hearing, you know, news from overseas, and it's, you know, it's going to raise questions about, you know, why is Australia using these vaccines compared to other vaccines, you know, and also about the rollout process for the vaccines. It may raise questions about the safety of the vaccines, and also about the effectiveness of the vaccines. And I think that's important, that last point, because you know, we are still getting that little bit of confusion about, you know, what are these vaccines doing, and what's their role. And I think, you know, when I try to answer that now, it's about reminding people that, you know, these vaccines are doing such a great job in reducing severe disease and severe, you know, hospitalizations, and also severe outcomes while in hospital. And a great fact I came across the other day was that um, in a study of um, intensive care units in the United States, um, of the patients who had COVID in those settings, 97% of them were unvaccinated people.
Wow.
So the vaccinated people who may still get COVID are getting such a mild disease that it's not sending them to hospital. And, you know, they're not having these severe outcomes, severe, which is the, you know, the terminology that we're looking to measure the impact of these vaccines on, compared to their unvaccinated counterparts. And so that is critical. Both vaccines are doing a great job on that. What they're also doing, and there was some recent research out just this week that shows that these vaccines are also doing a great job in reducing transmission. You know, not at the levels that maybe we see in other vaccines, and that's okay. These, you know, this is what we're going to live with for a while. But they are actually, what we found is actually reducing what we call the viral load. There you go, a bit more jargon to add to our collection. So it's
Is
how much
is that
how
in
much
here?
I'll have to check that.
Is that in here?
I'll make myself a note, add viral load. And what that means is the amount of virus that you have in your body. And so when you have high viral loads, you know, every time you sneeze, these viruses are just coming out, you know, out of your nose, out of your mouth, you know, all over your hand, you know, you're just shedding it. So when you reduce your viral load in your body, you may not then spread it to as many people. So at the moment, if you're unvaccinated and you have COVID, we think that you may be spreading the virus to about 6 to 9 other people around you. So if we reduce the amount of virus that you have by getting vaccinated, you then may only spread that to 2 other people, which is great because we can then shut that down. it takes the pressure off the contact tracers because we know those two people.
Mm.
We can then help to reduce the burden and the pressure on hospitals. But importantly, hopefully those two other people are vaccinated too, which means for them, they may just feel something like a bit of a cold, or they may be even what we call asymptomatic. So they don't have any sort of known symptoms. They don't feel like a fever. They don't feel like they've got a sore throat or a cough or any of them. And so this is what we've got to get to, and this is where the encouragement is to get everyone vaccinated, because we may still see COVID around, but we could see COVID around in such a different way that we have seen with other respiratory viruses. That
Mm.
yes, they are out there, but because we've got that protection, we hammer them on the head, and they just can't do the damage that the virus could do if you're unvaccinated. And that's what we need to talk to when we talk about effectiveness, and kind of remind people that there are different things that these vaccines are doing, and that if we still have a bit of COVID around after, we've got 80% of our population vaccinated, and especially all of our vulnerable people vaccinated, that we're gonna be in a great position.
I've always wanted to ask this question, and now I've got someone, of your knowledge that I think I'm going to get a straight answer from.
Oh no.
So this vaccination, this particular vaccine, when I was in Turkey, I got the TB shot, and I just missed out on the smallpox. My sister got one. I didn't get one because it was cured. Um, so is this something that we need to have every year, like the flu shot, or do we have it once? And or in this case, let's say 2 doses, and then that's it. We don't have to worry about it. Is this going to be a part of our yearly vaccination routine?
That's a really good question. And we will need to see what happens with time. Smallpox was very different because smallpox, who it lived in and how it transmitted, was very, very different. So we were able to put a big block between the transmission and stop it spreading. This virus acts in a different way, and it can live in animals, and it can live in us, and it's
Mm,
okay, out floating in the air, and so we need to treat this, differently. And so whether or not we get to needing what we're firstly calling booster shots. So this language, this word will start to come into everyone's what they're hearing and reading. And this is where the suggestion is that even within maybe a year, we might need to give everybody one more vaccine to just help the body increase again the level
mm,
of protection or immunity that they have. And that's okay. We routinely give kids these booster shots as well. So they may receive a vaccine at age 1 and 2, and then at age 5, they get another booster to try and just help their body. And that then gives them lifelong immunity. Even with adults, back in the day, you used to get a tetanus shot every 10 years.
mm,
Yellow fever would only last, X amount of times. That was very, very short. You'd have to get it, and now they've changed that language because, and the recommendations, because new findings have come along. And so I think, we may need to have a booster, whether or not it then goes into a space of needing to receive it every year with your flu vaccine, every 5 years, every 10 years. This will be what we'll continue to look at, and the modeling will be done, the drug studies will be done, and we will really look at the epidemiology, so the numbers of cases, and how they're, what populations are being affected, to see whether it is needed. What we may find down the track, it's a vaccine that becomes recommended when you get to a certain age, or when, if your health status changes and you become maybe immunosuppressed, or you have a chronic health condition.
mm.
Maybe it will be then targeted groups that we need to continue to protect. and see what happens. It's also going to depend on what this virus does. So, in other situations with this particular family of viruses, some of them have just disappeared. And this is what happened in 2003. And then we have this other, part of the family with MERS in the Middle East, where once in a while it keeps kind of popping up, having a few more cases, and then disappearing again. So this family of viruses are very strange. And whether or not this one wants to kind of move in and be a permanent family member with us, I think we'll have to see what the crazy uncle wants to do down the track. But certainly other family members of this particular virus family have acted in very different ways.
So it might also say, look, I've had enough. Thanks very much. Sayonara.
I'm out of here. I've done enough damage.
Nice knowing you. See you later.
He's hoping one could hope that this virus gets the signal that we've had enough of it. Pack your bags, disappear, please.
That's going to be one massive farewell party, I assure you.
Will it ever? That's wouldn't that be lovely? And something to and that is again what we should be motivating it, but also that we need to be realistic. So we need to be realistic that we certainly we've done almost 2 hard years with it, not quite 2, but we're getting there, closer. And the vaccines are playing a key role in shifting us to the next phase, certainly getting us to a new space with this virus. I don't think it means that we have seen the end of mask use. I think we are already seeing in the US that there's some need for masks. We may still need to see the use of isolation, so people staying at home if they've been exposed, or quarantine if they think they've been exposed. And we still got to negotiate how travel's going to go, and so this will be part of our conversations, part of what government needs to work on and decide. For a year, a couple of years, we'll have to wait and see. But we know how to wear a mask now. We know when to use it. We know how to use it, and that's great. People are really good with needing to social distance when they need to, and so we've got those strategies down pat. We've got this toolkit, vaccines plus these other public health measures that probably we're going to continue to use for the near future.
Yeah, well, I guess the Homo sapiens ability to adapt and its resilience is the reason why it's been, one of the longest living mammals, I guess.
We've survived pandemics in the past. We will get through this one.
Let me bring you back to the glossary. How was it developed? Who was involved? Let's give some kudos to the people that were involved.
Oh, look, I'd love to give a big shout out to everyone, and I'm just going to get my list so I don't forget everybody. So, of course, as mentioned, I'd like to give a big shout out to Lisa Woodland at the New South Wales Multicultural Health Communication Service for really kind of spearheading, the translation component of the work. The development was calling on colleagues and from both the immunisation side of things and the multicultural health side of things. So Dr. Kylie Quinn from Remit University and Dr. Sabira Shrestha from the National Centre for Immunisation Research and Surveillance, as well as Associate Professor Chris Blythe from Telethon Institute in WA were really, the eyes on it from the immunisation side of things, and they're all experts in vaccines and vaccination. Beyond that, a big shout out to Vicky Jacobson, who is at the Refugee Health Network up in Queensland. She was instrumental in bringing together other colleagues that she works with, NAATI accredited translators from the Refugee Health Network. I'd also like to give a big shout out to the Health Literacy Lab here in Sydney, and Carissa Bonner, who works there. she was able to actually test the glossary to make sure that it was at the correct reading level for the population that we were focused on. Of course, all graduates were a big help here too in really pulling me up and saying, oh, Holly, we've got to change up this language or this framing of the different terms. And also Dr. Nadia Shavers, who also was great in just sending me text messages and saying, Holly, this isn't working yet. Keep going with it all. So there was a fabulous team on the ground who helped with putting it together. And to everybody who has passed it on or spread the news about the glossary, then, sorry, I thank you too, because we want it to be useful. We don't want it to just be sitting on a website and just.
I know.
That's the main thing, and certainly I've passed it on to colleagues overseas too to see whether it can get some traction internationally as well.
That's great. Look, I think we'll all do all we can to get it out there. Just want to ask you a question in particular about translations. Now, as you know, with NATI, there are different levels of certification and recognition as well for languages that aren't being tested. And depending on the language, there are sometimes translators and interpreters out there that are unaccredited. And this is simply because there are just no certified or recognized practitioners in these languages. Okay, this is reality. And even among the certified practitioners and recognized practitioners, many different terms might be used by different practitioners. Now, this is why I believe that glossaries play a vital role in standardizing that information and preventing possible ambiguities when translating and interpreting. What are your thoughts on enforcing the use of glossaries? Let's say this particular one, the COVID-19 glossary. Enforcing it upon government organizations who commission translations and then language service providers who actually give the translations out to the practitioners to say, this is the language that must be used, okay? Whatever information that you're disseminating that needs to get translated, here's the glossary, you must use this. And then that gets given to organizations. The organization gives that glossary to the language service provider, who then gives it to the translator and says, here's your glossary, you have to use it. Otherwise, it just, again, it's a choice. Whether, first of all, does the translator even know that this exists? Trust me, you're going to have about 12, maybe 15,000 certified and recognized translators, plus on top, many unaccredited ones. First of all, are they going to have this information that the glossary exists? Secondly, are they going to choose to use it? Can we actually make it mandatory to say you have to use this glossary when you're disseminating information about COVID-19 vaccinations?
Look, there's an interesting point raised. To make something a mandate, it does change the sentiment around it. If the glossary wasn't, if people weren't accepting of it, then to make it a mandate would really go against what the purpose of was introducing it, because it would be resented. And if people don't feel comfortable with it, then they're going to find workarounds anyway. And so instead of going with a mandate, what we really want to do then is to work on supporting them to use it. And so again, making sure that they understand that it's available and the reason why it was developed. Making sure that they understand who was part of the development process, so they that they
trustworthy,
that it was developed with those who work on both sides of the coin, and to make it as easy to use as possible. And so as part of the kind of process of kind of understanding the needs of the community, when people started to talk about this kind of gap in how to talk about COVID vaccines, and this idea the glossary came through, many people commented about, well, wouldn't it be lovely to have it, via an app and make it, at your fingertips. And so, we agree with that, and we would love it to be as accessible as possible. The challenge was, of course, navigating funding opportunities and support, and we were able to land on having it online on a website, and to have it translated. And so this may be an ongoing evolution of the glossary if it needs, if it becomes something not just about COVID vaccines, but about vaccination in general. Maybe that's where we could help with putting it into an app. There are certainly other examples of glossaries being used. I think that the best one is that one available for helping with jargon around the kind of national disability scheme. I know there's also
that
one.
definitely needs a glossary.
Oh, I think there is a glossary.
Yeah, I know there is. It's just the field that definitely benefits from having a glossary.
A lot of jargon there too. And then there's also the ones for helping people navigate terms around law and around.
Yeah, there's one called Legal Literate.
Legal.
Yeah, so that's a very, very good app actually.
Yeah. So we've got some precedents around those glossaries and how they've been used. And so what can we learn from that to apply here? But certainly, maybe it is about going back and advocating for some more funding to turn this into something that can be on your fingertips via an app.
Well, we'll do everything that we can to share it with everyone, and lobby with the powers be, because it's the funding is an investment, isn't it? It might be a few $100,000 today, with potential of billions and billions of dollars of income, that might not be lost. So yes, we definitely will do our best. Now on that, how can people access the glossary? And as you know, like you said, glossaries evolve, and they get updated. If anyone has suggestions either for a correction or for a new term or definition, who can they contact?
They certainly can check out the website via the New South Wales Multicultural Health Communication Service, and I'll make sure that the website is sent through to add that with this webinar.
I'll put it into the description. Okay,
oh, there you go.
Definitely, so they can just click onto it.
If people have any questions, or they would like to raise any issues with the glossary, we are all ears about hearing that, and also about if there's anything in the language translations, especially where the words just still not quite working, please via that email, you will see my email address there. It's very transparent that we want to hear from community and keep this a live document. And I think I'm really going to go back and add viral load. I've written it down.
Put it on there. There we go. We're saying it evolves, and just today another new term. Now we were saying that people can just email you directly. I'll put your email address in the description as well. And I guess going back to my question about making it mandatory, we could make it available with the jobs, I guess, and say, well, we recommend that. Here's the glossary. Here's the glossary, and that's another way of getting the word out there, especially to practitioners who will be hopefully using this tool to aid with their translations and interpreting as well.
That would be great if we could make it, right at the fingertips. That the link is there when you organize, when governments at any level then are organising translations around this vaccine, and certainly also amongst the community organisations themselves, many of whom are doing their own translations. That this document's ready to go.
All right, everyone watching out there, now you know about this document. You have no excuse. Get it out there. Thank you, Holly. Thank you so much for your time today, and all the best with getting the glossary out there, and to those communities who are in much need of non-ambiguous and good information about the COVID-19 vaccine.
No, happy to talk, and thank you everyone for your time.
And thank you very much. Please don't forget to subscribe and turn on notifications. Today I was with Associate Professor Holly Seale. Thank you very much, and all the best to you.